So this kind of goes along with what was discussed earlier. You know, a thing to remember is that adverse reactions could happen with over-the-counter drugs too, and a lot of times things like this could be avoided just as long as patients are educated. And this is going to be a big part as an athletic trainer. What you're going to need to do is to be able to educate patients on, you know, what's safe and what can be taken and how it should be taken. So again, I have some examples up there. I discussed this one already, the Tylenol or the acetaminophen with the hepatotoxicity. Ibuprofen, if taken inappropriately, can also lead to a lot of gastrointestinal problems because of the effects it has on inflammation. With pregnancy, it's actually uncertain the safety of most drugs. Part of this is due to the lack of testing. The safest thing, we'll talk about some particular drugs, once we get into specific classifications that are commonly safe with pregnancy. The safest bet is just to always consult with the physician, and even to consult with the pharmacist if there happens to be any doubts in as far as how pregnancy goes. So that takes us to pharmacokinetics. So pharmacodynamics dealt with the effects that drugs have on the body. Pharmacokinetics deal with the effects the body has on drugs. So we know that when we take a drug, it has effects on the body, but there's also things that the body will do that will affect how the drug gets utilized. And we have up here some different factors that pharmacokinetics are based on. Another thing to consider is that we have essentially 4 phases of what happens with a drug when it enters the body. We have absorption, distribution, metabolism, and elimination, and we'll be discussing all of those. So this chart just kind of summarizes the pharmacokinetic process. So you could take a look at this in as far as what's going to go on with each one of those phases. And as I stated, we're going to go through and describe what goes on with each one of these individual phases. This kind of just highlights and organizes it. You can see in each individual section, it also discusses what are going to be the primary kind of players, if you will, in each process. So for instance, when we look at absorption, we look at the primary absorption areas being the gastrointestinal tract, the skin, or the lungs, and then it goes through with some of the other individual phases. So kind of review this a little bit, and as we go through, you'll see some of the connections that we'll be making with each individual section. So the one thing, obviously, that the body has to do when a person takes a drug is to absorb it. So the absorption is going to be basically the body taking in the drug, and there's factors that influence that. So there's basically 3 different things that will affect how fast a drug gets absorbed in the body. It will be look at the drug's solubility, so what type of solubility the drug has, the intended site's surface area, and the route of administration, which we'll be talking about some different administrative routes. Obviously, taking a pill orally versus getting something injected is going to change a lot in as far as how an individual drug gets absorbed. Looking at your different types of administration and how that affects drug absorption, you have your enteral administration. This is everything administered via the gastrointestinal tract. So everything taken in via the gastrointestinal tract is considered enteral. 2 questions I want you to kind of answer on your own. What is the usual onset of the drug action, and how does gastric emptying affect drug absorption? Okay, so both of those can be answered by looking in your textbook. Your different types of enteral administration, the one we most commonly think of is your oral administration. For instance, just taking tablets and capsules via the mouth. Sublingual and also rectal, which you have with a lot of your suppository-based medications. All of these are subject to what's called a first pass effect. As they're getting absorbed, the liver will metabolize some of the drugs. This will cause a decrease in the amount of drug being delivered to the site. So the dosing will kind of accommodate for that when they're looking at dosing of different drugs. The sublingual gets absorbed in the oral mucosa. So this is the sublingual medications will usually be placed underneath the tongue. They have a tendency to be absorbed much faster, and they also do not have to go through the preliminary passage through the liver as well. So a little different as far as how the sublingual drugs get absorbed. And primarily with all of these, you look at systemic effects, so more wide-ranging effects throughout the whole body.